And joining us right now on the program, very pleasure to welcome a man who has written a book that I think is going to answer a lot of questions for people. Obviously, the topic of health care is going to be huge in the upcoming election once again in 2012. The name of the book is called Heaven or Health, the doctor's common sense plan to save our health and our healthcare system. We're joined by Dr. Craig F. Beyer today. And Dr. Beyer, thanks for being with us. How are you?
Well, thank you very much, Doug, for inviting me on.
I want to have you on once our friends over at Newman sent me the info about the book. I think everybody's got questions about healthcare, but I think your angle, which I think people are going to find probably most helpful, is that you're an actual physician, you're an ophthalmologist, so it doesn't only affect patients, but it affects doctors as well, right, this whole healthcare situation.
Yeah, I think it's been sort of interesting. If you watch the healthcare debate over the past few years, the two groups that really have been largely absent, it's been individuals and physicians.
Right.
I mean, there's certainly a lot of special interest groups involved and politicians, and they seem to have this cure without any idea of what really is happening in the healthcare world.
You see all these plans put out, obviously, with President Obama's his plan. Of course, you have Mitt Romney a few years ago in Massachusetts, and now the Ryan plan put out there, and none of them seem to be making people happy.
No,
and costs are probably going to go up, right?
Yeah, and I really can't support any of those plans. I mean, really it comes down to, there's a few issues here. And I think the one issue why we're in this mess to begin with is there's this, well, where do I start? The first issue is people think that healthcare is more expensive than it really is. So if people understood that 85% of all medical transactions cost less than $5,000, they'd be more willing to pay for it somehow themselves through like a pre-tax HSA or something. But what's happening is most patients are so fearful because they get these crazy medical bills from hospitals and things like that that just don't make any sense. And what those bills are really not accurate. The bills, there's all these reasons why those bills are artificially inflated, and that's what the patient sees. So they're scared to death and they go out and they buy too much insurance coverage, or they make the government try to take control of the situation. So that's why we're in this mess.
Yeah, I think you bring up a good point there with insurance. Is that what's driving up the cost mostly? Is insurance, or what is it?
It's funny. I was talking to someone about this, and really, when you look at people that have reviewed my book, they'll say that I point the finger at third-party payers and insurance providers. And certainly I do point my finger there, but I'm also pointing my finger. It's the way the system is designed. This is why we're in the mess we're in now. The healthcare system, the ultimate design is just fundamentally flawed. And it goes back even further. It goes back to the way we elect our politicians. It's fundamentally flawed. There's so many special interest groups that have so much, politicians have to raise so much money to get elected that they have to do things that aren't necessarily functional for the individual. Okay, so that's how far back it really goes. So they make these promises to try to make healthcare affordable. At the same time, they have to make sure the insurance lobby is involved and participating actively, so it's profitable for them as well.
Yeah, I've always heard the theory, and it seems logical to me, if insurance companies, or you're allowed to have insurance sold throughout the whole country rather than state-by-state rules and all that kind of thing, the whole price would come down. Is that true?
Colorado. Yeah, that's true. Colorado, we have 4 health providers. It's like a monopoly. It's like, if you look back at what happened, I'm sure you're at least my age, and back in the 60s when AT&T had the phone monopoly. Remember long-distance bills? It was actually into the 70s.
Sure. Yeah.
When long-distance bills, you didn't get a long-distance bill for less than $120 a month, and that's calling, interstate.
Right.
And then MCI came along and things changed. And it's the same thing with healthcare. It's a total, if we had more competition, healthcare premiums really should be no more than term life insurance. If you look at a term life insurance policy, how much does it cost for $1 million to a $2 million life insurance policy for a 40-year-old plus person? About $100 a month. But health insurance is like $500 a month, right? So it's almost $300 to $500 a month, depending on the state. So you're 3 to 5 times greater. What are the odds of you having a $2 million health insurance bill? Like, not much. Okay, less than 1%. If you walk out and get hit by a bus and you have a $2 million health insurance bill, probably want to be dead anyway. You know what I'm saying? So that's why we have an issue here, is because the health insurance, really, they make people worry that they don't have enough coverage. So an average 30 or 40-year-old who really, I mean, I'll give you an example with my family. I have a family of 4. I switched to a health savings account because I was spending, for my family of 4, $1,500 to $1,700 a month for health insurance.
Wow.
And that was just a typical PPO, provider network, or preferred provider network. So then I went ahead and I switched to this plan where I have a $5,000 deductible. I have 100% coverage after $5,000 for the whole family. So how much did I really spend out of my HSA last year? $600 for health care out of my HSA. So I'm allowed to put pre-tax $6,600 into my HSA each year. So I have $6,100 still in savings from last year. Plus, I saved another at least $5,000 on not paying health insurance premiums. You see how much savings that is?
Yeah. And are the HSAs, are they, I mean, I've got recently, from a company where I worked at, the forms to fill out, you can join the HSA. Is that catching on?
Well, here's the problem with the employer situation, and it's catching on in a negative way, unfortunately, for the employees. Because of the new PPACA rules, employers are mandated to provide health insurance. So what a lot of the employers are doing is they're mandating HSAs, so they're saving the money, but they're not putting money into the employee health savings account. Mm-hmm. So really the way to work this out, and I've seen this happening in Colorado, is most people will still, if they have the choice, will elect for a PPO because the individual himself, the premium is the same. I mean, it costs the same to them, and they don't have a benefit of getting a savings account. In other words, if the employer is paying $500 per person for a PPO for their employee, wouldn't it be better for the employee to just have the employer pay $100 per month and put $400 in their savings account? Right. That would be the ideal situation. Then everyone would do that. I mean, if you're a 30-year-old employee, that would make all the sense in the world, because that $400, you can use it for anything health-related, which is nice. I mean, if they want cosmetic surgery, if they want LASIK, they want anything, they can get that, and they don't have to go to some doctor that's assigned to them. They have much more choice.
Now, can you open an HSA on your own, or do you have to go through your company?
Well, if you're self-employed, that's easiest. That's what I've done. Mm-hmm. So certainly it makes total sense for people that are self-employed. Right. Now it's just trying to get the employers to catch on. And even if the employers, instead of paying $500, they pay $100 to $200 for the insurance, saved $100 and put $200 in the employee's savings account, that's still a win-win for everybody.
Yeah.
Well,
it sounds like it's a start, but it's not going to fix the whole problem, though, is it?
Well, that's the one start. Then we get the Medicare issue, which is a whole nother mess. And,
I know it's a complicated thing, but obviously some group of people, whatever age they decide, are going to have to take less. Isn't that what's going to have to happen to fix it?
Well, that's exactly what's happening. It comes down to, I had read this article and I actually included it in my book, which I thought was a really good insight of what's happening. No matter what in life, you have to ration, right? When you go to a restaurant, are you going to spend the extra $15 to buy the lobster, or are you going to just be happy with just, the hamburger? And you make these decisions every day. But in healthcare, for some reason, people think, healthcare is unlimited. I can have, especially, in the entitlement group, I can have all I want anytime. Then there's no restriction and no limitation. And people believe that. The politicians tend to enforce that belief system. But in reality, they're going to ration the care. And so you have a choice. Would you rather ration it yourself or have the government ration it for you? If it were my decision, I'd rather take care of my own life than have a bureaucracy take care of my life.
Yeah, I think you're a lot safer if you do that.
Exactly. And there's so many. The thing that's so important is that most illnesses, over 70% of illnesses, are self-inflicted. So, these are things like coronary artery disease, diabetes, hypertension. All these type of illnesses are related to, diet, exercise, these types of things. So wouldn't it be better to be able to take, for instance, if you're a senior and you make over $100,000, your pre-taxing or your taxable annual income is $100,000 or greater, wouldn't it be better to have the option to put $5,000 a year in a pre-tax savings account? With that money, you could have 85% of all your illnesses would be paid for. basically, because most things are cost less than $5,000. You could spend it on chiropractic, you could spend it on massage, you could spend it on acupuncture. You know, there's ways that you could spend it on things that are keeping you healthy instead of spending it on things that it's too late.
Yeah.
You know what I'm saying?
Now, we talked briefly before we started the interview, Doctor, about many physicians unable to maintain a practice. I mean, if nothing's changed, is that going to be a problem for more and more doctors not being able to? I guess obstetricians probably the most affected, but I guess all doctors are affected, right?
Well, no, really the groups that are most affected right now are the groups that are 100% dependent on Medicare. So,
oh, is that right? Okay.
Yeah, so cardiology, what's happening in Medicare is they've been decreasing reimbursement for doctor services. So, for instance, in ophthalmology, one I'm familiar with, cataract surgery, 1985, they paid $2,500 for a cataract operation. Now it's $479 in the state of Colorado. So that's how it's progressively gone down since that period of time, and doctors are just barely hanging on. Now, if I just did cataract surgery, I mean, there's no way we would be in business still. We still have private paid medicine as well. But what's happening now, as of January 1st, 2012, it's slated for another 27% cut. So, unless Congress acts, they usually try to prevent these cuts. There's these automatic cuts that go into place. And it's called the sustained growth rate formula. If they don't cut it, if they don't stop it, 27% across the board for all physicians in the country, which would be devastating to Medicare. So here's what's happened in cardiology. Their expenses continue to go up. Their IT requirements have gone up. But their reimbursement has continuously gone down, and there's nothing they can do about it because everyone over 65 is covered by Medicare. So there's a monopoly of patients. They just, here's the Medicare patients. We're going to pay you what you're going to get paid. You can't balance bill them. It's against the law. So what happens? They go out of business. And what's happening now is they're trying to form bipartisan support on the Hill. They want to drive Medicare patients into centralized systems called ACOs, which is just a reformation of an HMO. In other words, they're going to centralize medicine. It's going to be like what I experienced when I was in China, state-run institutions. The only difference is the hospitals are going at risk and the physicians are going at risk, like the HMOs, and they're going to pay them per, a monthly fee per life covered, basically.
Yeah.
So ultimately, I think that system's going to collapse.
That's not something I don't even going to want to hear.
But
well, I know you give a 10-point plan, Doc. I mean, don't go through it now if you want people to read the book. But I mean, you do have a plan in the book that could turn things around, right?
The whole problem would be solved. Like I said, I mean, the role of the government should be a safety net. I'm not advocating that we leave people that can't afford health care out in the streets. I'm advocating that we take care of those people, and we do have a centralized location to take care of people that can't afford it. But why would you want to keep people who are in control of their lives and their health care and have income into a system like that? You know what I'm saying? I mean, this is where the problem is, and it kills technology. It kills the advancement of medicine. So all seniors have to do is, instead of saying, you see these TV commercials where they go, "Don't touch my Medicare," and it's kind of being silly. I mean, all they have to do is say, you know what? Let us have $5,000 put in our HSA to spend any way we want, pre-tax, and give us 100% catastrophic after that. That's all they have to ask. So it would save the government billions, because most procedures, like I said, like cataract surgery, $3,000. They could pay it out of their pre-tax HSA. And that's a one-time, lifetime event. So if they roll, the extra $2,000 would roll into the next year account. They have $7,000 saved. You know what I'm saying?
Yeah. No, I think that makes a lot of sense. Obviously, with the pre-tax, it's another 20% value on top of that because you're not paying tax on that money. So
why should, for instance, the 30-year-old subsidize? Right now, we're subsidizing Medicare. Younger generations through taxes.
Right.
600%. If you know what I'm saying? So that's just ridiculous.
Well, a lot of helpful information in this book. It's called Heaven or Health. We've been talking with Dr. Craig F. Beyer. Craig, you have a website people can get a hold of you or the book?
Yeah, that'd be great. It's heavenorhealth.org.
Easy to remember, heavenorhealth.org, and just out a week or so ago, and I think a lot of people are going to get some good information out of this, Doctor, and hopefully in the next election cycle, some things will be done.
We'll see.
Doctor, thanks for being with us.
Well, thank you very much for your time.